Good morning, everyone. Bonjour tout le monde. Distinguished guests, esteemed dignitaries, and you will hear that I'm Italian through the speech. Prominent researchers, dedicated clinicians, public health leaders, and valued colleagues. My name is Chiara Brovero. I'm the Vice President and General Manager of bioMérieux Canada, and it's a true pleasure to welcome you to the fourth edition of the bioMérieux Canada Antimicrobial Resistance Symposium here in Toronto. As a company leader in infectious disease in vitro diagnostic, bioMérieux is proud to convene this growing community of experts, clinicians, researchers, and decision makers. Together, we are tackling one of the most urgent public health challenges of our time, which is antimicrobial resistance. This challenge is real. According to the Public Health Agency of Canada, resistance infection already contribute to close to 14,000 deaths annually. If current trend continues, up to 40% of infections in Canada could become resistant to first-line antibiotics by 2050, with an estimated impact of more than $20 billion loss to our GDPs and significant increase in healthcare costs. This symposium is more than an event. It's part of our commitment to driving positive change in AMR by raising awareness across all levels of public health. What began as a one-day technical conference for microbiology and molecular labs has evolved in a 2-day multidisciplinary forum. Our goal is to provide unbiased medical education, showcase Canadian scientific leadership, and foster long-term engagement with the clinical and scientific communities. Held during the World Antimicrobial Awareness Week, this symposium reflects our growing ambition to generate meaningful dialogue and action across healthcare settings. Over the next 2 days, we will explore how to strengthen antimicrobial stewardship across diverse care settings, how to reduce low-value care and improve sepsis management, how to embed equity, evidence, and innovation into AMR strategies, and how Canadian research and policy can shape a more resilient, One Health-oriented response. At bioMérieux, we believe that no single organization can solve AMR alone. It takes collaboration, innovation, and shared sense of urgency. Thank you to our partners at EPIC and the University of Toronto, to our collaborators, and to all of you for being here. Your presence is a testament to the momentum that we are building together. Welcome to the symposium. Merci.
Bonjour tout le monde. Good morning, everyone. Thank you, Chiara. I'm Jessica Blavignac, Director of Medical Affairs for bioMérieux Canada. Before we begin, a few housekeeping notes. The program agenda is printed on the back of your badge. Washrooms are located in the hallways behind the coat check, and please silence your phone during sessions. The event app that you can download includes medical education materials for your reference and contact details for all of our collaborators today. We encourage you to share your insights on social media using hashtag AMR Symposium Canada. We are honored to have among us dignitaries and key stakeholders who share a deep commitment to AMR, including Chief Claire Soul of the Mississaugas of the Credit, represented by Elder Laforme, Chief Dennis Meeches of the Long Plain First Nations, Ontario Minister of Health Honorable Sylvia Jones will also do a presentation, and we will have a virtual presence of Geneva-based WHO representative Dr. Jean-Pierre Niemazi, just to name a few. We thank you all participants joining us online from around the world, and we are honored to welcome in-person global leaders who have traveled to be with us to share their best practices in AMS. These include experts represented by the bioMérieux Centers of Excellence, Université Sherbrooke Sius de l'Estrie, Henry Ford Hospital in Michigan, Tampa General Hospital in Florida, Texas Children's Hospital, the Hospital de Niño Roberto del Rio in Chile. Your presence underscores the global collaboration and commitment required to fight AMR. In the spirit of antimicrobial stewardship and raising awareness on the importance of choosing the right antimicrobial at the right time for the right patient, at the right dose for the right duration, we have set up a dedicated microbiology diagnostics laboratory in the Auxquels room, which is at the back opposite of this venue. We invite you to visit this interactive space to experience instruments firsthand and discover how laboratories' results inform clinical decision-making. This is a unique opportunity to see how stewardship principles translate into practice. This event would not be possible without our main partner, University of Toronto's Emerging Pandemic and Infectious Diseases Consortium. Our collaborators, AMR One Health, CanAMRNet, AMI Canada, Public Health Agency of Canada, Canadian Foundation for Infectious Diseases, the McGill AMR Centre, and the AMRQ. And we are deeply grateful to our sponsors, Merck, Pfizer, and Genome Quebec. Finally, I'd like to introduce our Masters of Ceremonies for the next 2 days, Frédéric Dubé, Director of Government Relations, Kasia Wojcik, our Senior Medical Science Liaison, and Patrick O'Neill, also Medical Science Liaison. And joining us from our main partner, EPIC, Natasha Christie-Holmes. They will guide you through the program and ensure a smooth experience. Wishing you all a wonderful 2 days amongst us. Thank you. Sorry, I'm just getting organized. Sorry about that. So we'll have Elder Laforme join us, please. It is an honor to welcome Elder Laforme, a respected knowledge keeper and band member of the Mississaugas of the Credits for Nation. His Anishinaabe name, translated as Winter Hawk, reflects the deep connection he carries to his heritage and the land. Elder Laforme is the author of 6 books on truth and reconciliation, works that draw inspiration from his dreams and offer profound insights into healing and understanding. Beyond his writing, he serves as an elder of the Four Colors Drum Circle, as a custodian of the Medicinal Wheel Garden at the Hartley Conservation Area, a space dedicated to cultural and ecological stewardship in partnership with the Toronto Region Conservation Authority. His presence today reminds us that the fight against antimicrobial resistance is not only a scientific challenge, but also a human one, rooted in respect for life, balance, and the wisdom of those who come before us. Elder Laforme will open this session by sharing teachings that bridge tradition and modern health, guiding us towards a more holistic approach to stewardship and care. Elder Stephen Laforme will also perform an official land acknowledgement for the 2025 AMR Symposium taking place on today and tomorrow. This important gesture honors the traditional territory of the Indigenous peoples and reminds us of our shared responsibility to respect and protect the land. Please join me in welcoming Elder Stephen Laforme.
Ani Bourgeois, Stephen Winterhawk, Indigenous Cause, Laforme, Indigenous Cause, Red Wing, Indigenous Cause, Oak Tree, Inini, Indigenous Cause. And as the lady just said, I'm a band member and a elder for the Mississaugas of the Credit First Nations. And I come, as someone already said, I come to represent my chief, who is Claire Salt. So you notice my long name and how we have a long list of names. This is because our people are close to this land, and the animals and the birds talk to us. That makes us who we are, possibly. So I'm going to read the land acknowledgement now. The Mississaugas of the Credit First Nations are descendants of the River Credit Mississaugas, an Ojibwe nation. Our ancestors occupied, controlled, and exercised stewardship over approximately 3.9 million acres of lands, waters, resources in southern Ontario. We are the treaty holders of our territory, the only First Nations in our territory that has proper land surrendered treaties with the Crown. Today we are on Treaty 13, signed by my ancestors and the British Crown in 1805, and the subject of a settled land claim in 2010, the Toronto Purchase Claim. I'll go on, but hopefully it won't be too dry. But we acknowledge the presence of the other First Nations who have used the lands and within our territory in the past and continue to use the lands today. Our territories have been home and traditional territory of the other First Nations since the time immemorial. Over the 2 centuries, the Mississaugas people welcomed settlers to our territory, providing them with sustenance, engaging in trade and commerce. Much was done over the last 240 plus years to deny or erase the Mississaugas people, our rights, way of being spiritually and culture, while fighting and prevailing against the weight of oppressive systems. We have always prioritized our community, and the land. On behalf of the Mississaugas of Credit First Nations, I warmly welcome you to the treaty lands and territories and encourage you to continue to learn from, care for, protect, engage with us, and enjoy this sacred place we call home. Aho. Miigwech.
Miigwech, Elder Laforme, please stay with me. My name is Frédéric Dubé. I'm the Director for Market Access and Government Relations at Biomérieux. I'll have the pleasure to introduce for the animation of the next session, Dr. Anju Bajaj. Dr. Bajaj is an award-winning STEAM educator, research scientist, and national leader in science outreach whose work directly support the mission of today's symposium, preserving antimicrobial effectiveness for future generations. Dr. Bajaj brings more than 20 years of experience advancing scientific literacy, research culture, and health-related inquiry among young people and educators across Canada. Her leadership has played a pivotal role in helping students understand global health threats, including antimicrobial resistance, and inspiring the next generation of scientists who will be essential in confronting challenges in public health, infectious diseases, biotechnology, and stewardship. Her distinguished contributions have been recognized through some of the highest honor in education and community leadership, including the Prime Minister Award for Teaching Excellence, the Queen Elizabeth II Platinum Jubilee Medal, the King Charles III Coronation Medal, the Women Empowerment Award nominee, the STEAM Educator Award, and several other provincial and national distinctions. Dr. Bajaj proudly represents Canada with MILSET, Mouvement International pour le Loisir Scientifique et Technique, promoting international collaboration and scientific inquiry that encourage youth to tackle real-world issues, of course, including those that lies at the heart of AMR. She further supports national scientist outreach through her role on the NSERC Promo Science Selection Committee, helping guide programs that build the research capacity our future health system will depend on. Her work has empowered thousands of students to explore microbiology, biotechnology, public health, and evidence-based decision-making, essential foundation for developing responsible antimicrobial practices and strengthening global preparedness. Please join me in welcoming Dr. Anju Bajaj, whose passion for science education and community health advocacy aligns deeply with our shared goal of acting today to safeguard antimicrobial effectiveness tomorrow. So for the next session, I have also the pleasure to invite Chief Dennis Meeches. Before we invite Chief Dennis Meeches to speak, I want to acknowledge why his voice is so important in today's AMR Symposium. Antimicrobial resistance is not only a clinical challenge, it is a community challenge. Chief Meeches brings decades of leadership, experience, and deep understanding of the reality faced by First Nation communities, including the impact of limited access to care, higher infectious burdens, and the structural inequities that shape health outcomes. His perspective is essential as we work to preserve antimicrobial effectiveness for generations to come. Dennis Meeches served on the Long Plain Council for 26 years, including 20 years as chief. Under his leadership, the Long Plain First Nation has garnered national attention for its governance and corporate vision. Dennis was instrumental in the government and economic growth of the Long Plain First Nations and the Treaty One Nation. As the Treaty One spokesperson, his priority was the creation of a joint reserve at Naui-o-Odena, formerly known as the Kapiong. At the present, he is with the following organization and company: President of the Tribal Consent Investment Group, President of the Spirit Health Care Group of Companies, and we'll let you know a little bit about the Spirit Health Care Group through a presentation as I continue his presentation. Chair of the Indigenous Travel, Indigenous Leadership Development Institute Board Member, President and CEO of Ogema Service, Indigenous Future Film Academy Board Member, Economic Development Winnipeg Board Member, Treaty One Development Corporation Board Member. Do you have time for you sometime? Do you take time? And he is on the Winnipeg Children's Hospital Foundation board member. Dennis is a horse rancher, recording artist, and known throughout the Powwow Trail as an all-star grass dancer and singer. Mesdames, Messieurs, Chief Dennis Meeches.
Thank you. There you go.
You go ahead.
Bonjour, Totemenanek. Sungwa begini udijnika sa penasi totem ginapkane makna nogam gagi mobe kama way apcho nishen chibimazet chanishnabe akna awaya. My name is Dennis Meeches. My spirit name is Strong Standing Eagle. I'm from the Bird Clan. I'm from Ganushkateak, which is Long Plain, in the Treaty One territory, the first of the number of treaties in southern Manitoba. I'm not a chief anymore. Well, they still call me chief, but I retired 2.5 years ago from public res politics, public service. But of course, I have to continue working for another 10 or 15 years, or 20, I don't know. But I'm very proud to be here. Doctor has invited me, and I had the pleasure of meeting Frederick and Andrea. So I want to, this morning, I'm going to talk a bit about history in Anishinaabe in my region, and as you know, the Anishinaabe people of this region. So the The Anishinaabe people actually cover a lot of ground here on Turtle Island, and around the Great Lakes, into Western Canada, into BC, the Midwest, into even northern Mexico. We go by many different names: Menominee, Ottawa, Potawatomi, Chippewa, Saulteaux, all the same Anishinaabe tribe, languages and cultures, very parallel with one another. So, as they said, being a chief, I was quite busy during my time as chief, but things have really quieted down for me. Although you see a lot of, the boards I'm involved in, it's a lot quieter for me nowadays. But I want to share a morning song with you. This is a song that I composed a few years back. I was raised by my grandparents, and I grew up on the Powwow Trail. I grew up involved in sun dances, sweat lodges, so different, the ceremony of Anishinaabe people. And I was fortunate, because there was a time in our history that all of this was banned by Canadian legislation that introduced policies of assimilation that really tried to break the back of the Indian spirit, the Anishinaabe spirit, and through residential schools, child welfare, and so the social fabric of the Anishinaabe way of life was almost torn apart. And there's, for many of us, the work to rebuild that, repatriate the language, repatriate the customs, the traditions of all of that is that work that we do. So this song is really a morning song for me, as you know, or throughout the day. The song is in my language, Anishinaabe language, speaks to the four directions, and of course all of you are from throughout Canada, and I'm just thankful to be here. So I'll share this with you, and you don't need to, just remain seated and listen to the song. Wabanen niwabedan atsukan ninakwena maneto kinakachi maneto ninagajig yao shawanen niwabetan atsukan ninakwena maneto kinakachi maneto ninagachi yao nagabao yang niwabedan atsukan ninakwena maneto ginakachi maneto ninagachi yao kiwetenang niwabedan atsukan ninakwena maneto kinakachi maneto ninagachi yao. Thank you. This is a shishiwan rattle. Of course, we have the drums. So I'm fortunate again to be raised by my grandparents. They were all singers, my grandfathers, my grandmothers. At a time in our history which was quite turbulent, and when they were young people, obviously they they went to residential schools. And can you imagine 10 months out of the year, children were taken from their home communities and placed in residential schools. So the communities were quite challenged with the, no children laughter throughout, those decades upon decades. So during that time, the grassland societies played a pivotal role in retaining the language and the ceremonies. Also, I just want to mention about the Medewan societies of the Anishinaabe people. Medewan society is more of a structured spiritual society that reflected on herbal medicine, body, mind, and spirit, the realignment of that. Our belief system was that if something was out within your body or your mind, or it would unbalance the spirit. So it's really important for Anishinaabe people to find that balance. And through all that intergenerational trauma that our people have had to walk through, I think, the resilience of all of that and to be able to come out of that, but there's still a lot of work to do. In 2016, while I was still chief, we declared a state of emergency at the Long Plain because of drug addiction. And to this day, it's still a unique challenge, not only with First Nations communities, right across the board, towns, villages, cities. What we're witnessing is really an unprecedented time in our history when it comes to the challenges of drug addiction. So I think a lot of Indigenous communities are working towards to try and walk out of that also too. It is a deep fog that we're in, but I think there's at the same time a lot of hope and optimism that we may be able to get through this, right? So, and it's people like yourselves that are really that anchor that position that we're in. My grandfather, he walked in two worlds. It's basically two-eyed seeing, believing that we have to. If anything ever happens to you, no chance. Always remember that you need to walk in two worlds. So if something unfortunate happened and you had a health issue, use contemporary medicine, Western medicine, but also our traditional medicine to balance that out. Sometimes that message is not received, and some may say, well, you should only use traditional medicine because it won't work, or use whatever. But my belief system follows my grandfather that we need the best of both worlds to actually move forward. So my time as a council member and a chief at Long Plain, 26 years, for me it is quite a long time, and my work has been really in the area, in the vein of economic reconciliation. So when you think about it, in provinces like Manitoba, if you go to any hospital in the province of Manitoba, it seems like the majority of the patients there are Indigenous. And being a chief, I was trying to figure out a way, economic development for me is key. It's important that we have those opportunities to be able to give to our young people and the next generations in terms of the economic path that we have to be on, because a lot of that was really taken away with the reserve system that was imposed on Indigenous people, right? So you have 663 First Nations across the province, over 660. There are actually 63 in Manitoba, and they have a very dysfunctional cycle, meaning that Indigenous governments, practically every 2 weeks or every month, or there's an election happening in Manitoba, but we don't know about it. It's not, it's not something that will hit the news. So my idea years ago was to actually try to find a uniformity in having election systems. So we would have, once every 4 years, Indigenous elections right across the province of Manitoba. Could not reach that. The Indian Act is so much ingrained within our system that it's hard to break free from that system in itself. And it's quite challenging to do that. So the Indian Act really from cradle to grave controls your life. So we're trying to figure out or walk out of that. And really it's about the relationship through those treaties, the sovereign relationship. So I wanted to mention those because that, when you think about it, that's part of holistic living. To be able to have, a good home to live in, a good job to work at, good training opportunities, employment opportunities, all those are key. So this is why I spent a lot of my time in the arena of economic development. I felt that was so important. So at Long Plain, we we started that journey way back, well over 20 years ago for myself anyway, being a chief, creating corporations, economic development corporations. And because I always felt like Indigenous people they seem to be patients of the industry, patients of the healthcare industry, patients of the the justice system, inmates of the justice system, because you see high numbers of that. The healthcare gaps between Indigenous Canadians and non-Indigenous is quite wide. So we have a lot of work to do. So that's why we keyed in on healthcare. The Spirit Healthcare Group of companies is part of the Tribal Council Investment Group. Tribal Council Investment Group been around since 1990s, and it's owned by 7 tribal councils. When I retired from res politics in 2022, and the chiefs asked me to stay on to lead the company as a president, so they amended the corporate bylaws. And then I joined a month later as an employee, and I worked there. I spent a bit of my time, 2/3, 3/4 of my time working on the economic sector with Indigenous governments, working with civic governments, provincial governments, and federal governments. So a lot of my work is ingrained within creating economic opportunities for Indigenous governments through Indigenous companies. So our Long Plain has a fairly good, strong economic foundation. We have hotels, gas bars, agricultural, and so many different things. We've synergized a lot of the work that we do within the Long Plain First Nation. Then with Treaty 1 Nation, we fought for Cap Young, which is a military base in Tuxedo, one of the highest within Winnipeg, a very, high income area. Anyway, when I went after Cap Young, I was only looking at 10 acres, 15 acres, but of course the federal government took a very, a stance towards not being, they did not want to work with the Indigenous governments. Myself and Chief Harvey Olson from Broken Head, we toured Cap Young, DND, and we got the song and dance, and I was saying, I don't think the federal government wants to relinquish Cap Young. It's such a hotly contested property, a very, very valuable property, but we ended up 21-year fight, we ended up getting 149 acres of that land. But to me, it represents a bright future in terms of economic development and ingraining the urban reserves within the city of Winnipeg. We have a number of them, creates a lot of employment opportunities, and companies like Spirit Healthcare will benefit from that. So Spirit Healthcare really was formerly known as Grand Medicine. We purchased it off Grand Medicine 6-7 years ago. And it's the largest distant care pharmacy in the province of Manitoba, only after Shoppers Drug Mart. So we service the northern communities. We service Nunavut, parts of northwestern Ontario. So that's our pharmaceutical side of things. And then we have medical and supplies, a medical supply division. So we also looking to branch across Canada, but as you know, it's quite difficult to ingrain ourselves with big pharma and trying to establish a footprint within the Canadian fabric, right? So it's quite difficult to get patched on there. And then the other area we've moved into is mobility and equipment. So we're trying to service a big need, and through Indigenous-owned companies and creating economic opportunities, employment opportunities for Indigenous people, but not only Indigenous people. So what I found with our urban reserves with Long Plain and Treaty 1, we employ people from all walks of life. So it's really created a strong partnership with all of our companies and the people that work within our pharmaceuticals, our medical supplies, and we're just going to be hoping to close a deal very soon in acquiring a company in BC, which is I'm hoping to have. We'd like to have that done soon. We actually have a company here in Toronto too, called First Canadian Health. That company actually processes non-insured health benefit claims for Indigenous people right across the country, except for BC. BC has their own First Nations Health Authority, which is something that other Indigenous governments are looking at, including Manitoba. So that's where we're moving towards, but it needs to be done. We need to actually be directly involved in the healthcare the transformation of healthcare. What does that look like in the future? So urban reserves, I think, going back to them, they'll be a big driver and a big opportunity to create medical clinics, urgent care centers. And we've met with the Premier a number of times, Premier Wabganyu, which I find to be a very, very strong Premier for this country and doing a lot of great work. And I think he has it right, not because he's First Nations, but I think he's doing something a little bit differently, and it seems to be working. And he's also looking at creating a Manitoba Indigenous Crown Corporation, unheard of in Canada. No other province has taken this type of step forward. So what does that mean? That means that the province and the Indigenous governments in Manitoba will come together and create a Indigenous Crown Corporation. And the benefits that flow from the Manitoba, the resources, the natural resources, and creating companies that will actually directly benefit Manitobans, including Indigenous people, is really, really important. So I think that's moving ahead. And the news was just, I think, coming out on that. And I think I'll have some involvement with that also, too. So I really, want to thank Dr. Bajaj. I met her some time ago. She sent me some questions. I said, what the heck? This is way over my head. I think I'm a bit over my element here. But I should have had I should have had my director of pharmacy come to this also, too. But it is important. As I mentioned, with the Medewan societies, grass dance societies, the sun dance lodges, the sweat lodges, a lot of our ceremonies involve herbal medicines, but also spiritual healing. So herbal medicines are really, I think, really important. And sometimes it's kind of a bit of a taboo, where Indigenous intellectual property or ownership of, sometimes, there's a bit of a feeling out there that, well, we should not involve ourselves with the herbal medicines and get Big Pharma to, work with us on it. But we see a lot of that happening. But I think we're moving in that direction eventually as a pharmacy to actually have a balanced out herbal medicine program for Indigenous people, because it is being used out on the land. There's all types of medicines that are being used on the land that will support the growth of and the balance of your journey, your medicine wheel journey that you're on for your short time on Mother Earth. I think that might be it. I know she's got some questions for me, so.
Yes, I'll come there.
Yeah, okay, all right.
You can have a seat there.
Okay,
Thank
all right.
you.
So, don't make them too tough there, Doctor.
No, I will not. Thank you very much. I know I will not be making very tough, very, very simple question. First of all, thank you, AMR. Thank you, everyone here. Before we start, maybe I can offer a tobacco as a sign of my gesture.
Well, thank you very much. Miigwech.
Thank you.
Yeah.
So that's a tradition, as you know, that is important. So thank you very much for your perspective here. So before I begin the questions, just want to acknowledge why Indigenous leadership and voices are important in this AMR conversation. So as our elders, Stephen Laforme and the chief, Dennis Meeches, reminded us earlier that antimicrobial resistance does not affect communities equally, and many First Nation communities face higher infection burdens, and the structural inequalities in limited access to care, and the significant challenges to the continuity of the treatment, especially in the remote, reserve, and the northern communities. So these realities means that AMR can hit Indigenous communities any sooner or maybe harder and with the fewer resources to respond. So at the same time, Indigenous-led health systems offer powerful models such as Your Spirit Care and other organizations for the prevention, stewardship, and community-driven resilience. So having Indigenous health leaders here today is just a meaningful, and it is essential if we want to preserve antimicrobial effectiveness, acting today for the future generation. So with that in mind, again, as you saw the presentation, I'm not going to put you on a spot, not asking very difficult question. So I just rephrase some of the question, maybe one or two with the interest of time. Is it okay if I ask the question on your behalf, people?
You got 3 minutes.
Yeah, just, 3 minutes only. Okay, I will be very, very quick then. Fast forward to that one. Okay, then I'm cutting all difficult questions and asking simple questions here. Yeah, you're lucky today.
I am.
Yeah, I was talking to Chief Meeches earlier too. This is how I came up with some questions. So you spoke about the shift toward the Indigenous-led health services. So from your experience, how can Indigenous leadership and the community-based model that can support the antimicrobial stewardship to help ensure antibodies remain effective for our future generations?
Is that question one?
Question one.
Well, okay. Yeah, so thank you for that, doctor. So Spirit Healthcare, we have about, 12 pharmacists, 13 pharmacists on staff. Obviously, it's quite a unique challenge in the northern communities, the infrastructure to be able to deliver safe, reliable medicines to the northern communities. And it's quite challenging to do that. For example, if there's a Canada Post strike, so our staff over 20 years, the company's been around before we acquired it, they've built up a solid infrastructure to be able to deliver to the nursing stations of the north and be able to, the labeling, the medication. So they've really had not too many challenges with that to be able to provide that service. And then a lot of the north, of course, there are challenges of getting nurses into the north, doctors. So a lot of that is changing, and I think a lot of that would be supported by telehealth in terms of being able to provide that type of service. A good example might be COVID. So when COVID hit, what did First Nations communities do? They actually locked down their communities. You could not come in or out of the community, and it actually opened our eyes. When you think about 2020, having good, clear vision, 2020 actually gave us a bit of a sense of why we have to have clarity within our world. And to have COVID hit, our company, struggling as it was a bit of who wants COVID? Nobody wants that. Nobody wants, we had to walk through the Spanish flu of 1918, and Indigenous knowledge keepers came up with herbal medicines to actually challenge that. But there's still a lot of, as you know, Spanish flu, there's millions of people perished all over the world. So with the COVID, it's still, I think, to be able to lock down communities, and that was really unheard of in terms of being able to restrict movement within the First Nation to help with to be able to secure the community. That was quite tough. I probably didn't really answer that question, but
I know, I just changed the question according to your talk, and there are a list of questions too, maybe with the interest of time.
You have 1 second.
We'll take it, maybe if you have any question, you can reach out to Chief Meeches and myself if you like to, then please let us know if you have a question. So with that note, I'd like to say thank you very much for sharing your expertise and perspectives. Your insights not only help us understand the challenges that Indigenous communities facing the AMR, but also inspire actionable solution for equitable and sustainable stewardship. So we deeply appreciate your leadership and guidance that you provide to both inform policy and practices in this critical area. And thank you very much, and thank you, Frederick, thank you, Jessica, and the AMR team for inviting us here.
Thank you.
What a song to start the day. Thank you very much, Miigwech Chief. Thank you very much, Dr. Bajaj. And I don't know if you noticed, but she did the traditional celebration recognition with Eldery Laforme and with you. And thank you for showing us how to interact with you guys. It's important for the reconciliation in this country. Thank you very much.
Around till about noon. If anyone want to have a quick chat, I'm more than happy. I'm on LinkedIn. I used to be on Facebook, but Facebook is such a toxic place, very dangerous place. So I got the hell out of there when I retired.
Thank you, Meeches. On a un invité spécial par vidéo. We have a special guest. She will present her talk through a video because if you look at the news, she's stuck for voting in Ottawa. Il y avait le vote du budget hier. Alors, it's my distinguished honor to present the Minister of Health of Canada, Marjorie Michel. Née en Haïti, Marjorie Michel est élue députée fédérale de la circonscription de Papineau au Québec en 2025. Elle est par la suite nommée ministre de la Santé du Canada. We have the Minister of Health of Canada at our AMR Symposium. It's something very important to notice. I mean, it tells a lot about the work we've done with all you guys to raise awareness, and we have her presenting her remarks as our opening session. For me, I'm very proud of that. Born in Haiti, Marjorie Michel was elected federal member of parliament for the riding of Papineau in Quebec in 2025. She was subsequently appointed Minister of Health of Canada. Passionnée par les relations humaines, la ministre Michel est titulaire d'un master en psychologie sociale, du travail et des organisations de l'Université catholique de Louvain en Belgique et un certificat d'études diplomatiques et stratégiques du Centre d'études diplomatiques et stratégiques. Dès les années 90, elle se distingue sur la scène internationale, conseillère à l'ambassade d'Haïti à Paris. Elle devient ensuite responsable de la coordination logistique de l'Assemblée générale de l'Organisation des États américains en 1995, saluée notamment par une reconnaissance officielle du gouvernement des États-Unis. In 1990, she began to make a name for herself on the international stage. As an advisor to the Haitian embassy in Paris, she went on to become responsible for logistic coordination for the General Assembly of the Organization of American States in 1995, receiving an official recognition from the U.S. government. Au-delà des titres, Marjorie Michel est reconnue pour son action sur le terrain. Membre active du Réseau des femmes d'affaires du Québec depuis 2005, elle a toujours milité pour la place des femmes issues de la diversité dans les milieux décisionnels. In 2021, she made history. Marjorie Michel became the first Black woman to be appointed Deputy Chief of Staff to former Prime Minister Justin Trudeau, an historic milestone for diversity in Canadian politics. En 2021, elle entre dans l'histoire. Marjorie Michel devient la première femme noire nommée chef de cabinet adjoint de l'ancien premier ministre Justin Trudeau, un jalon historique pour la diversité en politique canadienne. Son approche est profondément inclusive. Elle défend une vision de la santé ancrée dans les inégalités sociales, la santé mentale et la réconciliation avec les communautés autochtones. Her approach is deeply inclusive. She advocates for a vision of health rooted in social inequalities, mental health, and reconciliation with Indigenous communities. Mesdames, Messieurs, la ministre de la Santé du Canada, Marjorie Michel.
Bonjour à toutes et à tous. C'est un privilège pour moi d'ouvrir le Symposium 2025 sur la résistance aux antimicrobiens. Merci de participer à cet important événement qui se tient durant la Semaine mondiale pour un bon usage des antibiotiques. AMR is not a distant or hypothetical threat. Its impacts are being felt across Canada today in hospital, primary care, long-term care homes, and across our agricultural and environmental systems. Across the world and our country, we are reinforcing our response to address AMR with the WHO Global Action Plan. En 2023, le Canada a lancé le plan d'action pan-canadien sur la rame en partenariat avec les provinces et les territoires. Ensemble, nous élargissons nos systèmes de surveillance et renforçons la prévention et le contrôle des infections dans les milieux de soins pour protéger les patients et prévenir la transmission. Since 2021, over $28 million has been invested with an additional $5.7 million annually. This year is particularly important. Through our engagement with the G7, the World Health Organization, and the Global Leaders Group on AMR, we are pushing for stronger international coordination, equitable access to antimicrobials, and sustainable financing for innovation. La rame est un défi mondial et le Canada est résolu à faire partie de la solution. En tant que leader et expert dans le domaine, vous jouez un rôle clé. En partageant vos connaissances, en faisant avancer les pratiques fondées sur des données et en aidant les Canadiens à comprendre pourquoi la rame les concerne directement. Today's symposium is an important opportunity to do exactly that. We must work together to protect the effectiveness of antimicrobials for generations to come. Merci et passez un excellent symposium. Thank you.